Good morning. I would like to thank Professor Gary Pollock for his important longitudinal research and for the invitation to address this conference, Growing Up in Digital Europe. I would have really loved to be with you in person. As some of you may be aware, Eurochild is the leading regional network of organizations who work with and for children across Europe. Our network brings together about 4,000 national organizations from 41 European countries. Our main objective is to put children and their well-being at the heart of European policies. We therefore consider such longitudinal research and data as very important to ensure evidence-based approach to the necessary child-centered policies. We at Eurochild are deeply concerned about the situation children are facing today. Despite Europe being the wealthiest region in the world, recent data from member states reveals that in 2022, approximately 1 in 4 children, roughly 19.6 million children, or 24.7%, are at risk of poverty and social exclusion. The progress achieved in the past decades has been severely hampered by the combined impact of the COVID-19 pandemic, the wars, and the policy challenges that have arisen in recent years. Poverty is a critical concern for children living in Europe. We believe that it is the most urgent concern that needs addressing with the right effective policies. However, there are several other deep-rooted inequalities that are affecting our children, mainly family homelessness, children's mental health, quality early childhood education and care, the insufficient support for children in alternative care settings, and the digital divide. We must acknowledge the fact that a child's journey through childhood in Europe can differ significantly. We also know for a fact that children face challenges due to their family structure and whether they are growing up in vulnerable and disadvantaged circumstances, such as Roma children, children from migrant or refugee backgrounds, or children with disabilities, or children from the trans and LGBTI communities. It is therefore imperative that we have access to better data to ensure that allocated funding and interventions are directed to where they are most urgently needed. A historic step forward was the introduction of the European Child Guarantee. This EU policy and funding initiative are specifically designed to combat child poverty by adopting an integrated approach. For the very first time, all the European Union member countries are obliged to simultaneously be executing national plans aimed at addressing child poverty, while ensuring equal access for every child to essential services such as free education, housing, healthcare, nutrition, and early childhood development and care. The creation of these child guarantee national action plans should be instrumental in defining the specific target groups of children, the measures to be implemented, as well as the budget required. The monitoring and the evaluation processes are even the more important to ensure that the objective of such an important and essential measure is achieved. We are pleased that the European Union have provided for funding for the respective initiatives within the member states. It is worth noting that according to the national action plans, many countries have pledged to allocate more than the mandatory 5% of the ESF Plus fund. And they have also committed to utilizing other EU funds like the Recovery and Resilience Plan in conjunction with national resources. However, it is sad to note that after more than a year since the deadline for the submission of the national action plans by member states, the national action plans for Austria, Latvia, and Romania are still not found on the website of the Commission. I am afraid that this could mean that they have not yet submitted them. No member state, of whatever economic growth and wealth, can boast of not having poverty among the children of their own country. On the other hand, there are some best practices worth noting, such as the French government's 1000 Days campaign. France is among the countries actively participating in Eurochild's first year's first priority campaign, which focuses on early childhood development. I am proud of civil society organizations within the Eurochild's network. Eurochild collaborates with national child rights coalitions across Europe to advocate for increased attention to children's rights at the national level. I must acknowledge that Eurochild's advocacy has yielded positive results in several countries. Let me share some examples. Ireland established a child poverty and well-being unit within the Prime Minister's office earlier this year, an accomplishment our Irish member has been advocated for many years. Ireland has also launched a 10-year action plan focusing on the first 5 years of childhood. Portugal, on the other hand, has introduced legislation that ensures free access to public and subsidized early childhood education and care for low-income families. The Portuguese ministries for Education and Labour, Solidarity and Social Security have initiated the development of a comprehensive early childhood strategy. Portugal is also committed to enhancing alternative care systems, and our members have been instrumental in identifying priority areas through our Data Care project. The European Union can support civil society advocacy by reinforcing the requirement for the participation principle in the use of EU funds and by enhancing civil society engagement in the European semester process at both the national and EU levels. Unfortunately, Eurochild is informed through its member organizations that most EU member states, while preparing for the development of the national action plans, have not adopted the participation principle and have not involved civil society organizations. It is a huge pity to ignore organizations that are working on the ground and have direct experience of what child poverty is all about. High-quality data is of paramount importance, and here the GUIDE project assumes a particularly influential role. Longitudinal data is crucial for contextualizing the statistical information available through Eurostat and national statistical authorities. We require a comprehensive survey on the situation of children's rights in Europe to gather and publish longitudinal data that delves deeper than existing statistics. The survey should focus on individuals below the age of 18 and encompass various factors, including poverty rates, household surveys, early childhood education and care, participation, school assessment results, and mental well-being. Only with such in-depth, intersectional data can we effectively assess the effectiveness of government and EU programs, and gauge the overall well-being of children across Europe. In Eurochild, we have been working for many years to advocate for better data, to help decision makers design better policies, and subsequently allocate more funding for children in need. Now let me share a few examples. The Data Care project, which is run in partnership with UNICEF. Eurochild is working towards establishing a comprehensive European data system for children in alternative care. The project's goal is to promote the commitment of all European countries to assess the outcomes and impact of shifting from institutional care to family and community-based care for children. Eurochild has taken a significant step in this direction by advocating for an indicator within the Child Guarantee, which tracks the proportion of children in various forms of alternative care. Now, the Child Guarantee National Action Plans. So, Eurochild has conducted a thorough analysis of all the national action plans available on the European Commission's website. The analysis sheds light on the services and support that each government is focusing on, and the data used to identify children in need. This analysis proves to be a valuable resource for Eurochild's members working at the national level. The monitoring framework of the Child Guarantee offers a significant opportunity to advocate for more comprehensive and varied data collection concerning children, as well as for the more effective use of this data in shaping policies and interventions aimed at enhancing the well-being of most vulnerable children in European societies. First Year's First Priority campaign, Eurochild, in partnership with ISSA, is leading a Europe-wide campaign centered on early childhood development. This campaign is a collaboration with civil society organizations in 11 European nations to advocate for the inclusion of early childhood development in public policies, with a specific focus on marginalized families and children. Despite the consensus on the importance of a child's early years for their lifelong development and well-being, there is a significant lack of data, especially for children under the age of 3. Now, with regards to inclusive participation, Eurochild recognizes the crucial role of children, families, and communities in shaping policies and actions. It is important to prioritize the involvement of children as they are experts in their own lives. Eurochild's efforts have made them a leading force in promoting child participation in Europe. And we are pleased that the European Union now requires child participation in its funding programs and considers it a top priority in its child's rights strategy. Eurochild, in collaboration with the Council of Europe and its member organizations, has played a key role in developing child participation indicators, which are part of the Child Participation Assessment Tool, used to assess governments' effectiveness in implementing meaningful child participation. In summary, there needs to be a three-pronged approach for effective action to address the needs of children. We need to work together, the European Union, national governments, and civil society organizations. Then we also need research for an evidence-based approach to ensure targeted policy development and then the practical implementation of whatever is needed. There is also the need for a triangular approach to participation, whereby children, families, and communities are necessary to be involved. Comprehensive and comparable data is necessary at the country and European level to inform policy making and public spending, or rather, public investment in children. We need to make the case for improved data, focusing on children below the age of 18, building on well-being comparisons and policy work in Europe. We need to strengthen nationally collected statistics with academic rigor and skill at contextualization, which in turn will lead to more informed policy making. I look forward to the outcomes from today's discussions, and I would like to thank you all for your dedication to improving Europe's data infrastructure for better effective action to improve the lives of all children living in Europe. Thank you.